So everybody can see my screen, active listening and critical thinking. So, you know, we can hear many things without truly listening, as we may not focus on a specific event or sound. Listening is a very important skill and can have an impact on different areas of our lives, like how well we do our job, as well as our relationships with others. Sorry, someone else came in here. How well we do our jobs, as well as our relationships with others. Studies show that we spend, on average, a day, 70 to 80% of our waking hours in communication of some form or other. So just a quick breakdown, and I know the numbers don't add up exactly, but a quick breakdown is that we spend approximately 9% of our time, of that 70 to 80%, I should say, 9% of that is spent in writing, 16% is spent in reading, 30% of that is spent talking, and 45% of that time is in listening. So listening is a large part of our day-to-day lives. So listening can help us obtain information, it can help us understand things, and it can give us enjoyment, and of course it can help us learn. So we have active and passive listening. An active listener pays close attention to the words being spoken and responds to those words. An active listener will shift their attention from what is going on in their head to what is going on around them. A passive listener hears what is being said, but does not respond to it or remember what is being said. So how much a listener is paying attention to and involved in the conversation is the difference between passive and active listening. When you focus not just on the words that are spoken, but also on the speaker and the message, you significantly change how much you remember hearing. This can help you avoid misunderstandings or miscommunications. So very important. One more person coming in here. 1 second. An active listener will give the speaker their full attention and will show interest in what they are saying, either through their facial expressions, thoughtful questions given at the right time, and their body language. Another person, 1 second. An active listener will give the speaker their full attention and will show interest in what they are saying, either through their facial expressions, thoughtful questions at the right time, and body language. They will also notice the way the message is delivered by paying attention to the speaker's body language, the speaker's facial expressions, and changes in the tone and pitch of the speaker's voice. The goal here is to get as much information as possible and understand what is being said to you before you respond. Now, a passive listener, they're hearing you, but they're not really listening to what you're saying. They will not respond to the speaker or participate in the conversation. They're not paying attention to the speaker and will not remember the message that was given. So they're listening to the words, but not the message. Some reasons for passive listening may be that the listener is multitasking. Maybe they're not interested in the conversation. Maybe they're not feeling well and they're focused on that, on themselves. Or maybe they're just too tired to pay attention to what you're saying. The bad thing is that this can lead to incomplete and ineffective communication. So, some important benefits of active listening include, number one is trust. So sincerely listening to somebody invites people to open up to you. They understand that you care enough to actively listen and that you will not jump to conclusions based on minor details. The benefits of this can be a lifelong friendship and someone to depend on in tough times. You know, if you listen to them, they'll listen to you, sort of thing. It can give you a broader perspective. So this allows you to look at life from other new perspectives that you don't normally see and can change your thinking. It can help increase your patience. So surprisingly, being a good listener doesn't come naturally. This is something that you develop over time with effort, but the benefit to this is that your patience level will increase. This allows the other person to tell you their thoughts and feelings honestly and without feeling judged by you. It can make you approachable. So as you grow as a patient listener, people feel more comfortable and inclined to communicate with you. It can give you greater knowledge. So increased listening skills can make an employee more capable and competent in their job position. They will get more information out of meetings and instructions that they are given, which makes them more efficient and successful at their tasks. If you're working in a company, it can save the company time and money. Effective listening skills reduces misunderstanding, as well as it saves time and money by not having to start a task over again if important instructions were not followed the first time. And then there's problem solving. So if you're somebody who's in a leader or a manager position, listening to your employees or your colleagues can help you understand what needs to be changed or improved within the company or, you know, within a project, you know, the big picture or the little picture, just things that could be changed or improved on. So there's lots of good benefits of active listening. It's hard to believe that most of us are not good listeners. In my research, I found a little bit of information, and an author wrote a book. His name was Edgar Dale, and he says in his book that his research suggests that we only remember 25 to 50% of what we hear. That means that in every conversation you have with others, they will only pay attention to less than half of what you have to say. So that's kind of discouraging for us. Going the other way, if you're the one who's getting instructions or information, you most likely are not hearing everything either. Hopefully the 25 to 50% that you do hear includes all the information, all the important bits. But what if it doesn't? Can you imagine having a 20-minute conversation with a family member and only remembering 10 minutes of that conversation? I mean, that worries me. And I really think that I really should, makes me think that I should practice my active listening, because in a 20-minute conversation, only really listening to 10 minutes, that kind of worries me when I'm listening to family members or somebody who's important or giving me an important message. So improving your listening skills and becoming a better listener can improve several aspects of your life, like your ability to negotiate as well as your productivity. This can help you avoid any misunderstandings as well as conflicts. You can improve your listening skills by practicing active listening. So make an effort to hear what the other person is saying with their words, and also hear the complete message they are giving you. This involves carefully paying attention and not letting yourself become distracted by what is happening around you. So don't get distracted by thinking of a response to what they're saying while you are listening, or allow yourself to lose focus. That's sometimes easy to do if we get bored or start thinking of things that we have to do later on in the day. A good tip to help you stay focused is to repeat their words to yourself as they talk. This will help you stay focused and remember the information that you're given. You should also let the other person know that you're listening to what they're saying. Have you ever been in a conversation where you wonder if the other person is listening to you? It makes you wonder, should you continue talking or should you just, stop? Is the message getting through? Are you wasting your time and breath? Something as simple as a head nod, a smile, or the occasional uh-huh or yeah can let them know that you're listening. Throwing in the odd question here and there at appropriate times, or a comment to paraphrase what they've said so far, also lets them know that you are listening and understanding. Another tip to think about when you are acknowledging that you are listening is to be careful that you are not giving them the impression that you are agreeing to something they are saying when you're not really agreeing. You could find yourself in a situation where you have agreed to purchase a timeshare at the top of a volcano just by nodding your head or saying yes at the wrong time. So be careful with that. One second, please. Sorry about that. When you're face to face with someone, you can follow these 5 active listening techniques to become a more effective listener. So the first one, of course, is pay attention. Some of this we've gone over already. Let them know they have your undivided attention. Keep in mind that nonverbal communication speaks loudly. Maintain a relaxed eye contact, so, don't give them the stink eye while you're listening. Look directly at the speaker. Try to maintain eye contact, and this was surprising to me, 60 to 70% of the time. When I thought about it, my own conversations that I've had with people, I've thought about, okay, so do I keep eye contact 60 to 70% of the time? And I don't think that I do. So, that's something that was really surprising to me, to keep eye contact for that length of time while you're actively listening to someone. Block out other distracting thoughts. No daydreaming. Do not prepare a response while they are speaking. So if you're preparing your response while they are speaking, that means you're not really actively listening to them. You are distracted, you're thinking about what you're going to say. So block out other conversations and distractions happening around you. Put down your phone, which in this time of the times that we're in, everybody almost always has a phone in their hand. Watch the speaker's body language and allow them to feel heard and valued. Let them see that you're listening. So, number 2, nod your head every once in a while. Use facial expressions, for example, a smile, something like that, to let them know that you're listening and interested. Maintain an open and interested posture. So, if you're sitting somewhere, and I know sometimes it's not necessarily that you're not interested or you're not engaged, it's just comfortable, sitting with your arms crossed. That can make somebody think that you're not interested in what they're saying. And I know sometimes it's not the case at all. It's just a comfortable way that we sit. So make small comments like yes or uh-huh. Lean forward towards the speaker. Try to avoid distracting movements, looking at your watch or your phone, sighing, you don't want to do that. Fidgeting, and I was surprised about hearing about the yawning. And I know sometimes it's really hard for us to control our yawning, and it can be seen as an insult to somebody that we're talking to, but we don't actually intend it that way. But, if you can avoid yawning, which is hard, that was one thing that I read to let them know that you're listening, is to avoid yawning. So anyway, number 3 is feedback. So paraphrase, reflect back to them what you have said, paraphrase back to them what they have said to you. Of course, you're not going to want to interrupt them to do that, but at an appropriate pause in the conversation, that would be a good time to reflect back to them. Also, at an appropriate time when they pause the conversation, you can ask for clarification for anything in the form of open-ended questions. You can occasionally summarize their comments as well. Sorry, guys, I apologize. So another one is do not interrupt. Ask questions after they finish making their point, like I said earlier. Don't interrupt them with arguments. Hold back on your judgment and advice. Don't finish their sentences for them, and don't change the subject on them. So that's a good technique as well. Sometimes it's hard for us, especially if you're somebody who you think of a question and then you forget it when it comes time to ask it. Sometimes it can be difficult not to interrupt people and ask those questions, but it's just something to work on. And the fifth point is respond. So be honest in your response to them. Be respectful when giving your opinions. Treat them the way you feel they want to be treated or how you would want someone to treat you. You can validate their feelings. For an example, saying, I can imagine how frustrating that would be for you is, something to let them know that you've heard them and that you know that it was frustrating and you understand that. So responding to what they've said. So there are active listening, like barriers to active listening. And so I'm going to touch on some of these. Of course, all of these lists here that I have, they're not extensive. They're just some of the key points that I found interesting when I was doing my research. So active listening barriers. Here are some of the key barriers to active listening. So the first one is noise. Noise can be defined as anything that affects your ability to pay attention to and understand a message. So anything that affects your understanding of a message or affects your ability to pay attention. This can be in the form of environmental noise as well as distractions from your brain. For example, thoughts that can prevent you from focusing on the message. You may be forming a response to the speaker in your head, like I mentioned earlier, or your mind can wander, to your to-do list sitting there waiting for you at home, or, and it sucks to say, but you can just plain get bored and lose interest and focus in what's being said. So if you're aware of these things being barriers to active listening, that can actually help you consciously give your focus back to the speaker. It takes practice, but eventually you should be able to manage the distracting noises. If the noise is environmental, say you're in a room with the window open and there's lots of street noise coming in, you could close the window or suggest moving the conversation to a quieter area. Another thing that you can do is you can also, you yourself, practice blocking out external noise and focusing only on the speaker. Number two, attention span and partial listening. So, we're all human and it's not possible to maintain focus for an indefinite period of time. Even if you're extremely interested in something, your attention span will stray every once in a while to do something else. Take a drink or check the time, stuff like that. So, and multitasking, that can cause important parts of the conversation to be missed because when you're multitasking, you're not really paying close attention to the conversation. Another thing is listener bias. So, if you're listening to somebody, remember to keep an open mind and reserve judgment until the speaker has finished giving their message. Avoid jumping to conclusions. For example, I don't need to listen to this because I already know it, would be something that you might say to yourself, and that can, affect how actively you're listening to that person. Listener bias can be one of two things. It can be a bias with the speaker themselves, for example, their appearance or mannerism, or it can be a bias about the topic or message. So maybe it's not something that you agree with. Maybe you have a different view about something, stuff like that. So number four is listener apprehension. So listener apprehension, so this could be like fear or worry that you will not be able to understand the message, or that the information will be hard for you to fully understand, and that can affect how you listen. That can be a barrier to active listening. Lack of interest. The listener may have absolutely no interest in what's being said, and it's pretty hard to pay attention to the speaker when you're not interested in what they're saying. So a big barrier right there. Fluency in the language. So if the speaker is speaking a language that's not familiar to the listener, they will not understand what's being said, maybe 100%, and that can cause them not to listen actively. And you can understand how hard it would be to listen to a conversation or a presentation that's being done in a totally different language than what you're familiar with. So you can imagine that. Intolerance. The listener may be impatient and feel that the speaker is slow in communication, so they may interrupt the speaker with questions. So that's, we talked about that before, to have questions, but to wait until an appropriate time to ask them. Previous beliefs. Strong beliefs can cause the listener to be narrow-minded and not want to hear about new ideas. So, information overload. If you are being presented with a large amount of information, it's easy to be overwhelmed by all of the information and lose focus of the overall message. Ways to overcome this include asking the speaker to slow down to give yourself more time to process what's being said. You can ask them to repeat themselves, at appropriate times. And then you can also jot down key points to review later on. But that, to me, I did read that as a suggestion, but that, to me, I'm not sure that can kind of fall into the category of multitasking. And so, how much, I guess if it's just key points, you may still be able to listen actively enough that you wouldn't miss a lot of information. So, 1 second, please. Okay, so that brings us to attention and concentration. So let's transfer our new listening skills over to medical transcription. Listening is a huge part of medical transcription. It's not possible to convert audio to text accurately without properly listening. Here are some tips and ideas to help you improve your listening skill as a medical transcriptionist. So the first one is where. You must be in a good place before you start listening to the audio. Get yourself a good pair of headphones, noise canceling headphones, and have an area where you can be alone. You might not need noise canceling headphones if you do have like a good office where it's quiet and out of the way and away from distractions. So having other people around is a distraction that can make you lose your concentration. You will need to be able to listen without disruption. Having a calm mind, peaceful place, and a quiet environment can be a huge benefit to your listening skills when working as an MT. Number 2 is relax. So clear your mind of any stress or thoughts before you begin. Stay calm, breathe deeply. Do your very best not to lose your patience, and trust me, I get it. Some days it doesn't take much to lose your patience, but try your best not to. The only thing you should be focused on is the speaker and the audio that you hear. So carefully listen to every word and medical term. Do not assume you know what they're going to say. Just listen and focus on understanding them. Number 3 is listen. And I mean, like, really listen. A skill that you need to have in this field is the ability not only to hear, but to be able to listen. Hearing and listening are two different things. So in my research, I looked up the definition in a Merriam-Webster dictionary. Merriam-Webster defines hearing as to perceive or become aware of by the ear, and defines listening as to hear something with thoughtful attention. So differences between those two. And the fourth one is practice. You can start your training or practice at home in the evening. Watch videos or movies and turn on the subtitles and see if you can catch any differences between the text and the words the speaker or the actor is saying. If you have one of those fancy TVs where you can pause and rewind, and you think you hear something different, don't be afraid to rewind and listen again and see if you feel it, like if you feel it doesn't match, pause and rewind and see if it does actually match, or if you did, catch something that didn't match. It'll help sharpen your skills. So, whoopsies. Okay, lost my place, sorry about that. Okay, so is everybody ready for an active listening, a tiny game? And then I have a couple of exercises that we can watch a video and do some exercises. So this little exercise that I wanted to give you, I ask that you don't comment in the comment box right away. Let's go through everything. And if you know the answer, if you've done this quiz before, please don't give the answer to others. Let's just have a listen and see. So I'm going to read it off to you. So pretend that you are a bus driver. It is your job to drive the Main Street bus. One day you get on the bus and you start to count. At the first stop, 5 people get on your bus. At the next stop, 3 people get on and 2 people get off the bus. At the next stop, 2 people get off the bus. And at the next stop, 3 people get on the bus and 1 person gets off the bus. And that brings us to the quiz question. What color are the eyes of the bus driver? Did you guys get it, or did you get stumped? Do you want to start typing in your answers now? Go ahead. That's right. You guys are good, because when I first read that, I'd never heard this exercise before. And when I first read the exercise, that's right, your own eye color. You are the bus driver, so what color are your eyes? When I first read the exercise, I read through it and I said, well, it doesn't even say. How am I supposed to know? And then I read it again and I was like, oh yeah, I'm the bus driver. So I have to say it did stump me as well. So yeah, exactly. So a little bit of research that goes with that quiz is that research shows that when taking this test for the first time, 87% of people will not be able to answer the question correctly. And I was in that percentage of people. This changes to 50% when taking the test for the second time, when the test is given immediately after taking it the first time. If taking the test a third time immediately after the second test, 20% of people still will not get the correct answer. So yeah, you really have to listen, to that very first sentence when they say, pretend that you are a bus driver. So I found that really, really interesting. So I'm going to, right now, I'm going to just show you guys a video. Yeah, you were doing the math, exactly. I thought it was a math question too. I'm just gonna show a video here quickly. So just 1 second while I change my screen share. And I'm going to pause for just 1 second. Pause my microphone, I should say. Okay, so can everybody see the video that's getting ready to play? Okay, perfect. I'll start playing here.
The following video is for educational purposes only and is not.
I should just make sure everybody can hear it as well. Perfect. Thank you.
Not intended to be a substitute for professional medical advice, diagnosis, or treatment. Patients and medical events depicted in this video are fictitious. Any similarity to actual persons, living or dead, is purely coincidental. The purpose of this brief video is to provide you with a synopsis of the inpatient encounter. At the end of this video, you will have access to a simulated clinical chart for this patient. This will include an inpatient face sheet, the discharge summary, where the most important information is articulated about the sequence of the patient's stay, records of the patient's history and physical examination, progress notes, doctor's orders, radiology reports, labs contain medication record, and nurse notes. John Miser is a 73-year-old man who has felt unwell for the past week, dealing with what he considered to be the flu. Over the last few weeks, John has noticed an increase of unsteadiness when walking, which he believed was caused by an ear infection. He has fallen repeatedly at home. He has also noted an increased tremor and diffused muscular weakness. John's symptoms have only worsened, making him unable to even write or make his own bed. On July 11th, John was brought into the hospital emergency room by his brother after stumbling and staggering around his home for the last 2 to 3 days. John appeared quite weak and was ultimately admitted for a more thorough evaluation and treatment. You may now proceed by carefully reviewing the inpatient encounter chart prior to continuing with case study activities 1 and 2, including
Okay. So everybody could hear that okay? Okay, so I'm going to put up some questions here. So after listening to that little or watching that little video, what the first question is, a little fuzzy. Oh, sorry. Well, hopefully, you know, it'll be okay. Hopefully you got enough out of it. So I did fast forward through some of the stuff a little bit that was unnecessary. So hopefully that didn't affect it too much. So how old is John? Oh, keep your answers to yourself for now. Oh no, Patty had majored. I'm sorry, Patty. We do have another one that we'll try after this, so hopefully. You can just, you know, keep your answers to yourself for now. We'll go over them together. How old is John? Along with feeling unwell, what symptoms has John noticed, oops, typo, over the past few weeks? What did John initially caused the unsteadiness in his walking? Has John ever fallen? What other symptoms did he start to notice? And what date was John brought to the ER? So those are the questions. Answer as many as you can, and then we'll go over the answers here in a second, after I give everybody just a chance to answer those questions. Are we ready to go on to the answers, or do you need a few more minutes? Okay, let's move on to the answers here. Okay, good. And if you're not ready, don't worry about it. This isn't for marks or anything. It's just, it's just try and practice our active listening skills. So how old is John? He's 73. In addition to feeling unwell, what symptoms had John noticed over the past few weeks? He noticed an increase of unsteadiness when walking. What did John initially think had caused an unsteadiness in his walking? An ear infection. Has John ever fallen? Yes, he fell a few times. What other symptoms did he start to notice? Increased tremor and diffuse muscle weakness. And then what date was John brought to the ER? And that was July 11th. So now that we've had practice with this one, let's look at the next one here. And I'm just going to fast forward through the unnecessary stuff. Okay.
Nellie Price is a 30-year-old married cashier at a large grocery chain. Nellie has an unremarkable medical history with exception to her hospitalizations over the past year or two due to issues with alcohol and abnormal liver function. Nonetheless, she has been in good health. Recently, Nellie began experiencing symptoms of an upper respiratory infection. Despite this, she continued working, but left her job on 2 separate occasions due to fever, chest pain, and a nagging cough. After returning home from work, Nellie's husband took her temperature and saw that it increased to 39 degrees Celsius. She was short of breath, coughing, and began to experience chills, a worsening fever, and sweats. When Nellie began struggling to catch her breath, her husband called 911 and asked for an ambulance. On December 31st, Nellie was admitted to her local hospital for further investigation, evaluation, and treatment. You may now proceed by carefully reviewing the
Okay. So there we go. Now we heard Nellie's story. And let's get Nellie's questions up here. And I can't take credit for this. A couple of my coworkers put these exercises together for another project that they were working on. And they kindly allowed me to borrow this for today. So that was very kind of them. Okay. How old is Nellie? Why had Nellie been hospitalized over the past year? What did she start experiencing symptoms of? What were her first symptoms that caused her to leave work twice? What was Nellie's highest temperature mentioned in the video? And what date was Nellie admitted to the hospital? So I'll give you guys just a couple minutes, and then we'll go over the answers together. Let me know if you guys are ready to take a look at the answers together. Okay, let's go. So, how old is Nellie? She's 30. Why had Nellie been hospitalized over the past year? Issues with alcohol and abnormal liver function. What did she start experiencing symptoms of? An upper respiratory tract infection. What were her first symptoms that caused her to leave work twice? And they were fever, chest pains, and a nagging cough. What was Nellie's highest temperature? 39 degrees Celsius. And what date was Nellie admitted to the hospital? And that was on December 31st. So did you guys find the second exercise was easier than the first when you knew what to expect? Yeah. Yeah. So I thought that would be just a good little couple exercises to practice our active listening. So onwards, on to the critical thinking portion. So in order to understand a problem or a topic completely, we need to analyze the facts and ask probing questions. This is also known as critical thinking. The process of critical thinking involves being skeptical, asking meaningful questions, analyzing all possible solutions, and collecting data and info, and not blindly accepting that what you hear or read is the truth. If you are a critical thinker, you look at many sides of an issue before forming judgment. You ask questions before accepting the information. A critical thinker will not accept everything at face value. You are always curious and asking questions and wanting to know more about something. You see the possibilities as being endless, so it would seem that you were probably a creative person. You were good at problem solving because you look at many sides of the issue. You are independent and confident in your choices. So there you go. That's a critical thinker for you. So critical thinking skills include observing. So an observant person is able to pick out problems and understand why something may be a problem. They can also use their past experience to predict a problem that may occur even before it happens. You can improve your observation skills. You can train yourself to pay attention to your surroundings, practice active listening like we just talked about, and or mindfulness to deeply examine what you see and hear. So the second skill is analyzing. It's important to be able to analyze a problem once it has been identified. Do your research without bias, and ask applicable questions about the facts you find to ensure relevancy and in order to assess the problem objectively. Look at it from different angles. Can this be solved on your own or do you need help? Does your point of view need to be broadened? And then inferring. This is when you come up with answers based on the limited data that you have. To help evaluate the situation, you must look for and think about as many clues as possible. Not all inferences will be correct, so you must gather as much information as possible before you draw your conclusion. The fourth item is communicate. Keep an open mind when listening to others' solutions. Express your solution in a calm, rational way. Use your active listening techniques we learned about earlier, and be respectful. That goes without saying. Problem solve. So carry out your solution after you've identified and analyzed the issue. Your first solution may not be the best solution, and what works in one situation may not work in another situation. So steps for thinking critically. The first step is identify what the issue or the problem is, and then analyze why there is a problem and how to solve it. Search for information and data related to the issue. Organization of the collected information and data, and then create your solutions. Identify which solutions work and which solutions do not work, and then find better ways to make the solution better. Remember to be objective when you are carrying out critical thinking. Do not allow emotions or personal bias and thoughts influence your thinking. Be impartial when you do your research and only analyze the problem based on the facts you've collected. So, questions that a critical thinker may have. So here are some questions that a critical thinker may ask. What is happening? This is where you gather info and think of questions. What is the importance? Do you agree that it is significant? What am I not seeing? And this is a big question. Am I missing anything important? How do I know? Where did the information come from? And then who says so? Pardon me, 1 second. Sorry about that. So who says so? Is there something influencing the speaker? And then what if? What if there are other possibilities? Critical thinking skills can be developed and finely tuned. This will help you express yourself, gather important information, and read critically. Critical thinking can help you in any job you have or any of life's circumstances. So, exercises to help you become a better critical thinker. And I mean, there's a lot of these exercises out there available on the internet. So if you ever want to look into some of those. Sorry, guys. Okay, so number 1, try a different medium. If you are a visual person, you may try working through a problem in a different way, like talking it out or acting it out. This other one made me giggle. Talk to a child. Try to explain it and talk it out with a child. This can help you see the problem in a new light when you explain it to a child in a way that they will understand. Know your biases. So knowing what your biases are can help you work around them. You can look for information that contradicts your first assumption. Another one is going backwards. So working a problem from finish to start can help you catch things that you may otherwise ignore. Ask others. Different people will see things differently than you and also have different approaches to a problem. This can help you expand your thought process. Get out of your comfort zone. Introduce yourself to new facts, people, and content that you can work into your personal critical thinking. And then the last one is brain teasers. So challenge yourself to think outside the box to engage your critical thinking skills. Critical thinking exercise. So just a few little things, little riddles, so to speak, to get you thinking. And we're almost at the end here, so this should just finish us off perfectly. So if you just listen to my statement and then, come up with your answer, we can go from there. If you know these already, I apologize. Don't give away to the answer to those who don't know them. So, next. A man buys a new car and goes home to tell his wife. He goes the wrong way up a one-way street, nearly runs into 7 people, goes onto the sidewalk, and takes a shortcut through the park. I see that I made a typo. Park. Sorry, guys. A policeman sees all of this and does not arrest him. Why? So if you want to just write down your answer, we'll go to the next question and we'll go over all the answers at the same time. Okay. If you had a machine that could generate $1 million a day, what would you be willing to pay for that machine? Why is it against the law for a person living in New York to be buried in California? A little girl kicks a soccer ball. It goes 10 feet and comes back to her. How is this possible? In South Africa, you can't take a picture of a man with a wooden leg. Why not? How much dirt is there in a hole 3 feet deep, 6 feet long, and 4 feet wide? If it took 8 men 10 hours to build a wall, how long would it take 4 men to build the same wall? How far can you walk into the woods? How many books can you put in an empty backpack? Your friend says he can predict the exact score of every football game before it begins. He's right every time. How is that possible? Are you guys ready to look at the answers? Okay. There's some groaners here, so kind of like a dad joke. So here we go. So the man who bought the car, he didn't get arrested because he was walking. And then the machine that could generate $1 million, you wouldn't have to pay for it since you already own it. And why is it against the law for a person living in New York to be buried in California? It's because it's a crime to bury people alive. So the little girl kicks her ball, it goes 10 feet and comes back. It's possible because she kicked it straight up in the air. You can't take a picture of a man with a wooden leg because you have to use a camera to take a picture, not a wooden leg. Groan, I know. How much dirt is there in a hole 3 feet deep, 6 feet long, and 4 feet wide? None. Otherwise, it wouldn't be a hole. Another groaner. If it took 8 men 10 hours to build a wall, how long would it take 4 men to build the same wall? The wall is already built. No need for anyone to build it again. How far can you walk into the woods? And the answer is halfway, because after that, you're walking out of the woods. How many books can you put in an empty backpack? You only need one to make the backpack not empty. So, groan. And the score before the football game is always 0-0. So, there you go. Some groaners, I know. So, anyways, that wraps up my presentation today. And I just want to just kind of give you a quick glance at my resources. There were quite a few resources that I used for this, so just to give you a quick glance at them. And I'm just going to end the recording. Thank you all for joining me today. So does anybody have any questions at all with anything that we've gone over? Or I know that we're a wee bit over time here, so you're welcome, guys. Oh, thank you, Laura. Thank you. I apologize for the barking. I hope I didn't bark in your guys' ear. I tried to mute before that happened, but you're welcome. Thank you all for taking time out of your day to join me. Yes, exactly right. Yep. It's a work in progress, and that's exactly right. Have a good day, everybody. Bye for now.